Hi everyone, it's me, Robyn. Most of you will probably know that I work for the World Missions Department at Territorial Headquarters. So Majors Ken and Bev have asked me to share just a little update with you about what's happening with World Missions during the pandemic. Everyone on our team is obviously working from home, but other than that, we are pretty much business as usual, and we are very, very thankful that we are able to keep going full steam ahead in these times. One of the really unique things about this situation is that this pandemic is happening all over the world. And normally, when we respond to a hurricane or a disaster, those things tend to happen in one place or one region. But this pandemic, in a weird way, is kind of bringing us all together and uniting us all. And that doesn't happen very often. The challenge is that the pandemic is affecting every country differently and at different times. So while things seem, at least right now, to be getting easier for us here in Canada, things are going very differently in other countries. It is estimated that Africa is about 4 to 6 weeks behind us, meaning that the peak is still to come for them. If, for another example, Brazil is very quickly becoming the next epicenter of the virus. And as the most densely populated country in South America, that poses a lot of problems. Of course, these areas of the world are not as fortunate as we are to have the health infrastructure that we do. So the Salvation Army internationally is taking a very strategic and integrated approach to responding to the virus. We are working very closely not only with our implementing territories where the response projects are being done, but also with other supporting territories and international headquarters. And that requires a much higher level of collaboration than what we would normally do. So that's been really interesting to navigate. As a result of COVID, some activities on our existing projects have had to stop due to local government restrictions limiting gatherings and with staff working remotely. So as the projects have objectives and targets to meet, the timeline of these projects will be extended, and so some additional costs will come as a result of that. In other instances, activities have had to be modified in order to accommodate physical distancing. And so for some of our schools and children's centers, for example, teachers are doing the best that they can to provide educational materials and online classes. But that is a struggle for those who don't have access to the internet or even to a computer. So we've been working with territories to see how we can best support in those situations. In addition to that, we also respond through emergency services and what we call rapid response projects, which allow us to respond very quickly and effectively and to a variety of different needs. For example, personal protective equipment, COVID awareness, posters and flyers, hand sanitation stations, hand sanitizer, food relief, hospital gowns, and face masks and shields. So wherever possible and available, these materials are acquired locally in order to help stimulate the economies in local communities. It's also important to remember that other non-COVID related needs don't disappear just because of the pandemic, and in many cases, they are only amplified. Food security is a really big concern for many, especially in rural areas where local transportation systems have been shut down due to the virus, cutting access to markets where people need to go to buy food and other essential items. And there will also be many other long-term consequences of the pandemic that we can't even begin to predict yet. So please pray for the work of the International Salvation Army. Pray for Salvation Army officers, staff, volunteers, leaders around the world, and pray for frontline healthcare workers. Pray for the provision of food and supplies for people in need, and pray for a vaccine. And now I would be remiss if I didn't mention that you can donate if you are able to our Partners in Mission campaign or to our international COVID-19 relief efforts by going to our website, saworldmissions.ca. And also, if you have any questions about our COVID-19 relief efforts or about world missions in general, you can always send me an email at the address included in the email from the Corps, and I will do my best to answer them. So thank you so much for watching this video. I am really looking forward to the day that I can see all of your faces again and we can all be together. So thank you so much and have a great rest of your week. Bye!